Hey, what's going on? I retrieved this book from the people's vehicle today, and it is the Cannabis Health Index by Blesching, and it's a complete, well, rather complete, as of this point, list of the science behind cannabis uses in therapeutic beneficial candidates, and stuff like that. So what I'm going to do is show you some artwork that I got for placeholders for some of the glass artwork that I've purchased. I'll post pictures of those pieces, and then I'll read some of the conditions that I have my cannabis prescription license for. So first I'll show you the cork boards as they were. Okay. Alright, I'm gonna go ahead and read the table of contents for this book, the Cannabis Health Index by Uwe Blesching. Cannabis Health Index. Combining the science of medical marijuana with mindfulness techniques to heal 100 chronic symptoms and diseases, by North Atlantic Books, Berkeley, California. Contents. Preface, Introduction, You're Sick, Chapter 1, The Evidence-Based Science of Medical Cannabis. The Endocannabinoid System, A Brief Introduction. Cannabinoids and their receptors, cannabinoid receptor chart A, cannabinoid receptor chart B. 4' cannabinoids, anandamide, AEA, tetrahydrocannabinol, THC, cannabidiol, CBD, E-beta-carotene, EBCP. Cannabis, sativa versus indica chart, cannabis lore and legend, is cannabis a cure-all, is cannabis safe? What can I expect mentally and emotionally from using cannabis? What are potential adverse effects, physical, mental, emotional? How do I reduce the risk of adverse effects? What is the suggestive therapeutic window and how do I establish it? Does the use of marijuana lead to addiction? How does use of the plant affect the development of adolescents, issues of fertility, or the developing fetus in pregnant women? What are the effects of inhaling burned plant material on the lungs? What is the plant's impact on the heart? What is the plant's impact on the development of cancer? Marijuana and schizophrenia. Cannabis a gateway drug. Can cannabis kill you? What about contaminants? Forms of cannabis, modes of administration, and summary. Chapter 2. The Art and Science of Mind-Body Medicine. A brief introduction to mind-body medicine. Molecules, emotions, and conscious interventions, complex connections in the endocannabinoid system. Molecules and emotions, a two-way street. The biology of emotions, summary chart. Building and balancing chi. Molecules primarily associated with expansive emotions. Acetylcholine, I remember. Anandamide, I am at ease. Endogenous opioids, it feels so good when the pain stops. GABA, I am melting. Oxytocin, I feel for you. Serotonin, I am happy. Molecules primarily associated with constricting emotions. Epinephrine, I am scared. Dopamine, I am motivated. Norepinephrine, I am attentive. Cortisol, I am stressed. Glutamate, I am excited. Vasopressin, I am aggressive. Chapter 3. How to use the Cannabis Health Index, CHI. What is the CHI score? Importance of the type of research study. How should I use the CHI score in general? Possible CHI scores chart. How should I use the CHI score for a particular study? Evidence-based strain informs specific considerations. A setting, the intention, the exploration. Powerful questions, self-guide to deeper healing. Suggested blessings, suggested affirmations, anecdotes. Let food be thy medicine, take notice. Summary. Chapter 4. Diseases and symptoms A through Z. Aging and anti-aging. Anorexia and cachexia. Bacterial and viral infections in general. Bacterial infections. Gonorrhea, methicillin-resistant Staphylococcus aureus, MRSA. Viral infections, colds and flu, cough, encephalitis, hepatitis, herpes, HIV, and AIDS. Cancer in general. Bone cancer, brain cancer, glioma, glioblastoma, breast cancer, cancer caused by cannabis, cancer-induced night sweats, cervical cancer, colon cancer, colorectal, Kaposi's sarcoma, leukemia and lymphoma, liver cancer, lung cancer, melanoma, malignant skin cancer, pancreatic cancer, prostate cancer, rhabdomyosarcoma, skin cancer, non-melanoma, thyroid cancer, cardiovascular disease, heart disease, hypertension, stroke, cerebrovascular accident or CVA, diabetes, mellitus, eye disease and eye function, age-related macular degeneration, glaucoma, improved night vision, uveitis, fever and temperature regulation, fibromyalgia, hemorrhoids, inflammatory diseases in general, arthritis, osteosclerosis, interstitial cystitis, rheumatoid arthritis, gastrointestinal inflammatory diseases, esophageal reflux disease, GERD, inflammatory bowel disease, IBD, IBS, pancreatitis, periodontitis, insomnia, libido, lung diseases, asthma, chronic obstructive pulmonary diseases, COPD, mental disorders in general, attention deficit disorder, ADD, and attention deficit hyperactivity disorder, ADHD, anxiety, autism, depression, manic depressive disorder, bipolar affective disorder, post-traumatic stress disorder, PTSD, schizophrenia, neurological diseases in general, cannabis and neuroprotection, alcohol dependence and abuse, Alzheimer's disease, amyotrophic lateral sclerosis, ALS or Lou Gehrig's disease, epileptic seizures, status epilepticus, Huntington's disease, multiple sclerosis, MS, Parkinson's disease, Tourette syndrome, OBGYN, obstetrical and gynecological difficulties and concerns, abortion, miscarriage, infertility, childbirth pain, endometriosis, menstrual pain, morning sickness, pregnancy, osteoporosis, pain in general, chronic non-malignant pain, migraine, neuropathitis in general, neuropathitis, AIDS-related, pain due to advanced cancer, prion disease, Creutzfeldt-Jacobs disease, mad cow disease, sickle cell disease, skin diseases in general, acne, dermatitis, eczema, hair growth, unwanted hirsutism, hair loss, baldness, itching, pruritus, psoriasis, seborrhea, systemic sclerosis, vomiting in general, chemotherapy-induced nausea and vomiting, motion sickness, wound care in general, fractured bones, post-surgery wounds, spinal cord injuries. Chapter 5. Integrating mind-body medicine for deeper healing. 1. Applying the healing balm of deep relaxation. 2. Using your emotional intelligence for deeper healing. A. Taking ownership of where you are right now. B. Releasing the toxins of suppressed and repressed emotions. C. Identifying and releasing unhealthy mental emotional habits. Bias, prejudice, and judgment. 3 distinct habits: guilt, martyrdom, and harbored anger. D. Exploring and building healthy mental emotional habits. Discernment, curiosity, and tempered positivity. 3 healing habits: gratitude, compassion, and forgiveness. E. Transforming unhealthy emotional habits into positive ones. 3. Using the power of choice for our ongoing healing. 4. Reprogramming unhealthy beliefs and building beliefs that heal. 5. Finding the silver lining and wisdom in your illness. 6. Identifying and dissolving internal barriers to healing. The Cannabis Health Index Chart, Notes, Index, Acknowledgements about the author, get the free app, and monthly e-zine. Okay, so that was the table of contents for the Cannabis Health Index by Uwe Blesching. Thank you very much.
Okie dokie, so these are the corkboard holders that I have for my pieces, and I'll just tell you which ones that I put on each one in a moment. First, I just wanted to show you each one. This is the THC molecule. Here's a green flower of life, a red kind of design, another white flower of life, a bigger one, and then a blue one. In the thing that I was in, I lost the blue magnifying glass by Logie, which is what I used to put on here. This one I would put the octopus squid design on. This green one I would usually do, it was like a straight piece. This one would be Venom. This one would be the demon. And then I think I would just keep like smaller pieces on this, like a pipe or something. So these are the ones that I have.
Alright, now I'm going to go ahead and read some of the medical conditions that I would be using my cannabis for out of this book. and tell you what the studies show so far. Alright, my first would be, well, there's plenty that I would use it for like a therapeutic benefit for, to decrease chances of leukemia and lymphoma, liver cancer, lung cancer, prostate cancer or breast cancer, cardiovascular disease, hypertension, etc. But these are the ones that I currently have and what I'm going to be using it for sometime in the future. Lung diseases, asthma. Total number of studies reviewed, 7. Asthma is typically a chronic medical problem ranging from mild breathing problems similar to those associated with a head cold to severe and life-threatening emergencies that require rapid 911 interventions and transport to the nearest open emergency room. Asthma does not discriminate. People from all walks of life suffer from asthma. However, children and senior citizens are the most vulnerable. Some children outgrow their asthma while others do not. The causes for asthma are poorly understood and no pharmacological cure exists. Orthodox medicine focuses on diminishing occurrences and trying to control acute symptoms. Physicians typically use oxygens and bronchodilators such as albuterol, Asthmacort, Ventolin, and Theodore to open constricted tubes leading to the lungs. However, there is evidence that regular users of inhalers contributes to making asthma worse over time. So there's that to consider. Other commonly used pharmaceuticals include steroids and drugs that stimulate beta-2 adrenergic receptor sites, receptors that are less responses, including the relaxation and the smooth muscles in the upper airways. Some of the main triggers of the asthma attack include emotional distress, dust mites, mold, smoking, strong smells, pollution, indoor and outdoor, industrial chemicals, food additives, coughs, colds, and strenuous exercise. Common signs and symptoms include difficulty breathing, wheezing, pale skin, diaphoresis, sweating, fear and anxiety, tightness in the chest, coughing, clear sputum, or spasms in the upper airway. If you have an asthma attack, follow your doctor's advice or call 911. Cannabis and asthma. It has long been known that the inhalation of burned materials contributes to the diseases of the lung. This is especially true in smoking commercial cigarettes. It is almost counterintuitive to believe that inhaling cannabis can reduce symptoms or to be otherwise therapeutically beneficial to people with a lung disease such as asthma. However, smoking can be tolerated without the spasm or coughing. The therapeutic effects of relaxation and of the upper airway expansion, both important goals in treating asthma, may arrive relatively quickly. Since 1974, studies have been conducted to document the effects of cannabinoids on human patients with asthma. In the first of such trials, 1974, researchers developed a double-blind, placebo-controlled crossover study. Scientists enrolled 10 patients with stable asthma to test and compare the efficiency of smoked cannabis. Ingested THC, a placebo, and a pharmaceutical, isoproterenol, commonly used in the 70s to treat asthma. Results showed that while the initial effect of isoproterenol was more pronounced, the effects of smoking cannabis and oral THC lasted longer. These findings indicated that in the asthmatic subjects, both smoked marijuana and oral THC caused significant bronchodilation of at least 2 hours duration. By 1975, 8 stable asthmatics were enrolled in another study to determine the effects of cannabis on asthma, both chemically and exercise-induced. Results showed that in both cases, smoked cannabis, THC 2%, produced a prompt correction of the bronchospasms and associated hyperinflation, similar to isoproterenol. 1976, another double-blind, placebo-controlled study enlisted 10 patients with asthma to learn more about the potential therapeutic properties of cannabinoids in controlling the disease. Results showed that salbutamol and THC significantly improves ventilatory function. Maximal bronchodilation was achieved more rapidly with salbutamol, but at 1 hour both drugs were equally effective. The conducting scientist did not detect any variation in mood or heart rate during the application of THC and concluded that the mode of action of THC differs from that of the sympathomimetic drugs which stimulate the sympathetic nervous system, increase heart rate and blood pressure, or a derivative may make a suitable adjuvant in the treatment of selected asthmatics. In the following year, 1977, a study evaluated oral and smoked forms of THC compared to a placebo and isoproterenol in random, double-blind trial conducted on 11 healthy people and 5 patients with asthma. Researchers measured airway dynamics and heart rate during the experiment. Results showed that aerolized THC was less pronounced than isoproterenol in producing bronchodilation in the short term, 5 minutes, but significantly better in the long time ranges, 1 to 3 hours. The authors wrote, aerolized delta-9 tetrahydrocannabinol caused significant bronchodilation in 3 of 5 asthmatic subjects, but caused moderate to severe bronchoconstriction associated with cough and chest discomfort in the other 2. These findings indicate that the aerosolized delta-9 tetrahydrocannabinol, although capable of causing significant bronchodilation with minimal systematic side effects, has a local irritating effect on the airways, which may make it unsuitable for therapeutic use. These and the following studies' results have added more information about THC's ability to increase bronchodilation in asthma patients and highlight some of the difference in the available dosage, forms, and routes of administration of cannabinoids. In 1978, researchers administered an aerosol containing THC to asthmatic patients in a steady state of dosage ranged from 50 to 200 micrograms. Results showed that treatment increased the peak expiratory flow rate and forced expiratory volume in 1 second, and that the onset, magnitude, and duration of the bronchodilator effects were dose-related. Comparing the synthetic cannabinoid nabilone to the standard anti-asthmatic pharmaceutical terbutaline, researchers discovered in 1983 that while nabilone had some bronchodilation effects in healthy patients, it did not produce a therapeutic effect better than the placebo. The authors concluded that oral nabilone 2 milligrams does not result in significant acute bronchodilation in patients with asthma. Despite promising potential for the next 20 years, no studies on asthma and the therapeutics cannabinoids appeared on the horizon of the usual publishing outlets. However, by 2006, researchers from Boston had tested numerous novel molecules and exert their biological effects through the endocannabinoid system. The result of this exploration suggests the therapeutic potential of cannabinoids on inflammatory diseases such as asthma and allergic asthma. Here are some strain-specific considerations. The primary cannabinoid used in these asthma studies was THC, which binds to both CB1 and CB2 receptors. Sativas or sativa-dominant strains tend to contain a cannabinoid profile with a slightly higher THC, CBD, CBN ratio than that of indica or indica-dominant strains. The authors concluded, this is study summary. I won't read that because I basically just read that. Well, I'll read these, I guess, just to go over it again. Cannabinoids. This is laboratory and animal. 2006, Boston, Massachusetts. Potential reduction in inflammation in asthma and allergic asthma. Nabilone versus terbutaline sulfate versus placebo. 6 healthy people and 6 asthmatics. 1983, Pulmonary Disease Division, Departments of Medicine, University of California, Los Angeles, California. Moderate bronchodilator action in healthy people, but no difference compared to placebo in asthmatic patients. Aerosolized THC 50 to 200 micrograms. Asthmatic patients in steady state. 1978, Asthma Research Unit, Sully Hospital, Penarth, Welsh National School of Medicine, Heath Park, Cardiff, United Kingdom. THC produces bronchodilation in asthmatic patients. Aerosolized THC, aerosolized placebo, and isoproterenol, and 20 milligrams of oral unsmoked THC. 11 healthy people and 5 patients with asthma. 1977, bronchodilation lasts longer than with isoproterenol in healthy patients. Among asthmatics, 3 patients got better, 2 got worse. THC 200 micrograms in ethanol inhaler versus salbutamol 200 micrograms Ventolin inhaler versus placebo ethanol, 10 asthmatic patients. 1976, Asthma Research Unit in the Department of Pharmacology, Sully Hospital, Penarth, Welsh, National School of Medicine, Heath Park, Cardiff, United Kingdom. THC significantly improved ventilation function. Smoked cannabis 500 milligrams with 2% THC versus 500 milligrams of smoked placebo marijuana, 8 asthmatic patients. 1975, Division of Pulmonary Disease, Department of Medicine, UCLA School of Medicine, Los Angeles, California. 2% cannabis and isoproterenol caused an immediate reversal of exercise-induced asthma and hyperinflation. 2% natural marijuana, 7 milligrams per kilogram versus 10 milligrams of oral THC versus placebo versus isoproterenol. 10 patients with stable bronchial asthma. 1974, smoked cannabis and oral THC caused significant bronchodilation for at least 2 hours. The author concludes, the reaction of the respiratory mucous membrane to a noxious agent is to exclude it by swelling of the membrane with consequent narrowing of the passageways, and to dilute it and wash it out by hypersecretion. When these changes are limited to the nose, the reaction is called vasomotor rhinitis, stuffy or runny nose, from reasons other than allergies or infection. When they are significantly intense to include the bronchi, so that wheezing occurs, the name asthma is applied. Wheezing, a characteristic symptom of asthma, is an unmistakable sound. The tighter the airways, the higher the pitch. It appears akin to an internal smothering of or a suppression of something that is felt should not be released. Asthma is a struggle to breathe, but it is especially to exhale. Non-physical asthma triggers as well as non-physical asthma alleviators are well recognized and commonly noted in any emergency room setting. Most ER personnel know of cases in which a patient's respiratory distress was diminished or completely put to rest by talking the patients down. Conversely, mental emotional triggers of asthma have been studied. For instance, one such study published by the American Journal of Psychiatry in 1987 discovered that difficult or stressful dreams may contribute to asthma attacks while sleeping, and another experiment published by the American Psychological Association in 1993 discovered that asthmatic patients have up to 3 times the amount of nightmares compared to members of health control groups. In summary, aggravating factors may include being faced with a life situation you wish would just go away or wish that someone else would take responsibility for and make disappear, and a belief that avoidance would be the best course of inaction or action. Consider working towards deep relaxation, trust in the trustworthy, and develop trust in self, and work with the paradox of relaxing in the presence of constricting emotions and experiences. They also give evidence for food as medicine. Anise, bush tea, cocoa, garlic, nigella, turmeric, etc. I like to say at this point in time, I used to bike a lot, and I would smoke cannabis before biking, and I could bike for about 3 hours straight without getting tired, and I didn't experience any asthma, which was my primary problem, was athletic asthma. And so I just wanted to note that. And also, when I take a albuterol steroid inhaler, my heart tends to race way too much, and it makes me feel uncomfortable. This is anxiety. I don't really get too bad general anxiety disorder or obsessive compulsive disorder or panic disorders anymore, or social anxiety disorders, social phobias that bad anymore, but sometimes I occasionally do. So I'm just going to read this study summary. Cannabinol and THC meta-analysis. 2010, Universidade de Sao Paulo, Brazil. Cannabinol therapeutic potential, antipsychotic, and anxiolytic and antidepressant. THC adjuvant in the treatment of schizophrenia. Cannabis. 775 humans living with HIV and AIDS. 2009, MGH Institute of Health Professions, School of Nursing, Boston. Cannabis considered effective in treating anxiety and depression and other symptoms in AIDS patients. HU210, Animal and Laboratory Study Rats. 2005, multi-institutional and international study. Hippocampal cells are immunoreactive for CB1 receptors. Cannabinoids may induce hippocampal neurogenesis, which may explain their anxiolytic and antidepressant-like effects. Cannabis and cannabinoids. Literary Review Meta-Analysis. 2005, Psychiatric Drug Discovery, Lilly Research Laboratories. Eli Lilly and Company, Indianapolis, Indiana. Cannabis can modulate anxiety and mood states. Let me see. It's good for autism. I don't want to say that this soon. I haven't actually read that part. But it's beneficial for depression, which I study from, or I suffer from occasion to occasion. So I guess what I'm going to do is just read. This is from total number of studies reviewed is 8. Most people know what depression is, so I'm not going to read the information about what it is, but these are the studies. Drugs: 9-THC, delta 9-THC, delta 8-THC, CBG, CBN, CBC, CBD. Animal study mice. 2010, University of Mississippi. THC and other cannabinoids exert antidepressant-like actions and mood elevation. CBD and THC meta-analysis. 2010, Universidade de São Paulo, Brazil. Cannabidiol therapeutic potential, antipsychotic, and anxiolytic and antidepressant. THC adjuvant in the treatment of schizophrenia. Cannabis. 775 humans living with HIV/AIDS. I think I read this one before, and the other one too. 2009, MGH Institute of Health Professions, School of Nursing, Boston. Cannabis considered effective in treating anxiety and depression and other symptoms in AIDS patients. Win 55 212-2 synthetic CB1 agonist, animal study rats. 2007, Montreal, Canada. Central CB1 modulates mood and has antidepressant-like effects. HU210 CB1 receptor agonist, URB597, the fatty acid amide hydrolase inhibitor, AM251 CB1 receptor antagonist. Animal study. 2007, Department of Psychology, University of British Columbia, Vancouver, Canada. Enhanced CB1 activity in the hippocampus region of the brain produces an antidepressant-like effect. HU210 CB1 receptor agonist, animal and laboratory study rats. 2005, multi-institutional and international study. Hippocampal cells are immunoreactive for CB1 receptors. Cannabinoids may induce hippocampal neurogenesis, which may explain the anxiolytic and antidepressant-like effect. Oral doses of delta 9-THC, 2.5 milligrams to 5 milligrams. Human clinical studies, 3 patients. 2002, Department of Medicine, University of Miami, Florida. Decrease in itching, improvement in sleep, and resolution of depression and symptoms in patients with pruritus due to cholestatic liver disease. 2.5 milligrams of Cannabinol twice daily or placebo. 139 patients living with AIDS. 1995, St. John's Hospital, Tulsa, Oklahoma. Improvement in mood, 10% versus negative 2% with placebo. This is manic depressive disorder, bipolar affective disorder. Study of summary drugs. Delta 9 THC, Delta 8 THC, CBG, CBN, CBC, and CBD. Animal study mice. 2010, University of Mississippi. THC and other cannabinoids exert antidepressant-like actions and mood elevation. Cannabidiol, CBD, Placebo-controlled human case study, 2 patients with bipolar affective disorder. 2010, Department of Neuropsychiatry and Medical Psychology, Faculty of Medicine, University of Sao Paulo, Ribeirão Preto, Sao Paulo, Brazil, ineffective for the manic episode of bipolar affective disorder. Cannabis, human case study, 1 patient diagnosed with bipolar affective disorder. 2007, University of Louisville School of Medicine, Louisville, Kentucky. Cannabis reduced the number of depressed days and increased the number of hypomanic days. So it makes you a little bit more manic, I guess. Cannabis and various other cannabinoids. Literature review, 2005. Department of Psychiatry, University of Newcastle upon Tyne, Royal Victoria Infirmary, Newcastle upon Tyne, UK. Some patients claim that cannabis relieves symptoms of mania and/or depression. Cannabis Human Case Studies, 1998. Department of Psychiatry, Harvard Medical School, Boston, Massachusetts. Positive therapeutic impact based on individual case studies only. Strain-specific considerations. Only whole plant cannabis and CBD rather than other forms have been tested for treatment of bipolar disorder. CBD was not proven effective, while whole herb constitutes could be supportive. CBD has a great affinity for CB2. Whole cannabis contains cannabinoids activating CB1 and CB2. Sativas and sativa-dominant strains tend to contain a higher THC-CBD ratio, which slightly reduce CBD influence. Some patients have reported an alternative strains of cannabis used during either a manic or depressive phase. During depressive phases, cannabis patients may benefit from sativas, while during manic phases they might benefit more from an indica strain. So if I'm getting manic, I might take an indica, and if I'm getting depressed, then I'll take a sativa. This one was important for my mother. Schizophrenia. Okay. Selected studies illuminate aspects of the interplay of genetic and environmental influences of developing schizophrenia. In 2009, German and U.S. researchers conducted a double-blind crossover clinical trial with 42 patients, failing DSM-5 or 4 criteria of acute paranoid schizophrenia. I've got schizoaffective disorder, but they don't have that in this book. Results revealed that the CBD reduced symptoms similar to that of amisulpride but with significantly lower incidences of side effects. The authors of the study concluded Cannabinol revealed substantial antipsychotic properties in acute schizophrenia. This is in line with our suggestion of an adaptive role of the endocannabinoid system in paranoid schizophrenia, and raises further evidence that this adaptive mechanism may represent a valuable target for antipsychotic treatment strategies. Brazilian and Italian researchers conducted a meta-analysis of relevant literature in 2010 and suggested that THC was a potential adjuvant in the treatment of schizophrenia. Additionally, CBD emerged with the most consistent antipsychotic properties in dopamine and glutamate-based modules of schizophrenia. Drugs, cannabinol, CBD, and SR141716A CB1 antagonist. Meta-analysis, 2010, University of Serbia, Italy. Potential novel approach for treating schizophrenia. CBD and THC meta-analysis. THC adjuvant in the treatment of schizophrenia. CBD meta-analysis, 2010, Universidade de Sao Paulo, Brazil. CBD therapeutic potential, antipsychotic and anxiolytic and antidepressant. CBD versus amisulpride, 42 patients fulfilling DSM-4 criteria of acute paranoid schizophrenia. 2009, multinational research team, Cologne, Germany, and Irvine, California. Decrease in symptoms not different between both substances. CBD induced significantly less side effects. Anandamide. Antipsychotic naive first episode paranoid schizophrenics. 2004 Department of Pharmacology, University of California, Irvine. Anandamide elevation in acute paranoid schizophrenia may be a compensatory mechanism. Not really sure what that means, but that's okay. Strain-specific considerations. CBD, THC, and endogenous anandamide are examined in the context of schizophrenia. CBD has a greater affinity for CB2s. THC and anandamide bind with CB1 and CB2 relatively equally. Cannabis used in patients suffering from schizophrenia often choose a strain relative to their needs. If a generally more stimulating or uplifting effect is needed, patients tend to consider sativa or sativa-dominant strains. Those in need of a generally more relaxing or grounding effect tend to prefer indicas or indica-dominant strains with a relatively lower THC to CBD ratio, which likely favors CB2 activation. So that's probably what I'd be taking, is some kind of indica-dominant strain with a relatively lower THC to CBD ratio. Because I tend to get a bit more manic and than anything else. But those are a few of the things out of this book that I just wanted to go over. There's plenty more in here, and they've got a lot of stuff on just general health too, for mind-body medicine and that kind of stuff, and food is medicine, and a bunch of diseases. So this comprehensive source book combines evidence-based insights from more than 1,000 studies to present a convincing case for the powerful healing effects of medical marijuana on more than 100 chronic symptoms and diseases. Uwe Blesching, a former paramedic and PhD in higher education and social change focused on integrative healthcare, brings clarity to the process of making informed decisions about cannabis as a valid treatment and offer striking evidence that cannabis is remarkably safe and effective when used with the proper therapeutic window, especially compared with the risk of managing chronic symptoms with pharmaceuticals. The Cannabis Health Index is organized into condition-specific chapters with a at-a-glance rating of cannabis efficacy for each symptom, along with recommendations for use and sidebars that suggest related mindfulness-based practices that enhance the body's own ability to heal. Organized alphabetically from aging to wound care, the book covers a variety of conditions including infections, cancer, cardiovascular disease, eye diseases, inflammatory diseases, neurological diseases, and much more. The book is supported by a free app and monthly e-zine that supplement and update the book. The app uses the same rating system as the book, making it easy to determine at a glance what the current scientific consensus says about how cannabis may work for a specific condition. CHI magazine explores how the endocannabinoid system works as a bridge between the body and mind. This is published by North Atlantic Books, Berkeley, California. Printed on recycled paper. It was $24.95. ISBN is 978-1-58394-962-7. Copyright 2013-2015. So, anyways, thanks. Have a good one.